What's up, everybody? Welcome back to the Move Better channel. I am your host, Dr. Joe, and this is John, the Professor Penisarada. Here today, we're going to be talking to you guys about shoulder pain and more of an impingement syndrome. Now, John here has an impingement, and we're trying to work that shoulder out. Now, which shoulder is it that we're...
Right.
Okay, so you might have heard from a diagnosis that you've had that you do have shoulder impingement syndrome, and that's just simply a tracking disorder of that ball and socket in the shoulder. Now, there's a lot more things going on than just the shoulder pinching up against a few of the tissues inside the shoulder. But today, our goal here is just to fix it. How do we get moving through that? So the first thing that we want to do is we want to put pressure into the front part of that capsule. Remember, the capsule wraps all around that ball and socket of the shoulder. And so sometimes we need a little bit extra pressure. And the reason why I'm utilizing a 45-pound bar is because it's heavy enough to try to push into that capsule. Now, are we making huge changes with it? Not necessarily, but we're trying to influence the capsule. We're trying to wake it up. We're trying to get all the sensory information and pressure into that capsule. So first thing he's going to do is he's going to put that 45-pound bar on his shoulder here, in the front part of his pec or his chest muscle, and his shoulder, right in front of that the ball and socket. So as he's here, you're pressing in, and you feel that pressure right there? Mm-hmm. Good. Next, he's going to use his arm, and he's just going to try to go through range of motion. Now remember, abduction and internal-external rotation wasn't the issue. So we're just starting out with this, and we're going to go for about 5 to 10 repetitions just as he's rotating in and out of that shoulder. Then, John, I'm going to have you turn into it. There we go. Now he's getting into that position, that forward flexion, and we're trying to work on that internal and external rotation. That feels pretty good, huh? Mm-hmm. Now, do you feel the pinching when you go down in internal?
No, just soreness on the deltoid.
Just in the front part of the shoulder, right? So the deltoid is the shoulder muscle itself. And so we're trying to just get some range of motion. He's not trying to push himself into pain patterns, okay? When we push ourselves in pain, that's something that are flags. We want to be careful on how we're doing this. So he's trying to get his range of motion. He's trying to just influence that that front part of the capsule here as he's going in and out, and he's just doing that for about 5 to 10 repetitions. If we don't have a bar at home, there's a few things that we can utilize in order to try to influence all the muscles and tissues around those areas. We're going to utilize a foam roller here. Now, John, let's go ahead and switch you on the other side here. We're going to use a foam roller here, and notice the foam roller is kind of at a 45-degree angle here. And as he's pushing his body into that foam roller, he's trying to get the front part of that capsule into that apparatus, that foam roller. So here, he's just going to externally rotate, and he's going to work on putting pressure into that pec muscle and that front part of the shoulder. How does that feel? Good. That feels like a good stretch right there, right? Now remember, the problem was not an abduction or a part where his arm is away from his chest. It's in the front part of his body. But we're still being able to, once we are able to work on this part, now we could start bringing his arm internally, okay, into more of a forward flexion. So as he's pushing pressure, go ahead and hold. Rotate your body into it. Rotate, and that hold. Now you feel that pressure into that shoulder now, right? Mm-hmm. Good. Let's go ahead and bring that back. Now he's going to bring his arm up over here, and now we're going to turn this. Go ahead and sit on up. We're going to turn this, and we're going to face this into the camera. Now we're going to get into that forward position here. And now as I'm having him foam roll that part of the lat, or the what we call the stabilizer or the core muscles of the shoulder, which is the serratus anterior, we're putting pressure into his rib cage here, along with his lat, along with his subscap, along with his rotator cuff muscle, and we're influencing all of those tissues. And when I say influencing those tissues, we're putting pressure into them, we're waking them all up, so that way they can start working together with the capsule to be able to relieve pressure off of that pinching sensation in the front part of his chest. Now, notice how he's kind of going in and out right here. And you guys are getting the back side of this. We'll go ahead and switch over to the front side in just a second here. I'm going to have him bring his elbow out in front of him here. Perfect. Feel that pressure? Now he's trying to influence all the areas that control that underside of that shoulder, which is the rotator cuff muscles right on the back, the lat, the serratus anterior. That serratus anterior is a muscle that helps kind of stabilize and pull into protraction that shoulder blade. And protraction is rounding your shoulder out here. Sometimes a lot of people don't realize that that's a muscle that is underactive or not working enough. And so we're trying to influence all of these little tissues to help with gliding that shoulder in place the proper way. We're going to bring his hand over that wrist, and he's just going to help work on some rotation here as he's putting pressure. And now you're going to lean into it a little bit more. Do you still feel a pinch in that area or no?
No, I feel
more of that pressure under the bottom. Yeah, so now he's feeling more of a stretch, and those tissues are actually gliding the way we need to, or what we call centrating properly. That ball and socket is in place and where we need it to be. So now he's here, he's going to rotate back, and now as you're here, go ahead and let that arm go up. Now if you guys are watching this, follow at home. Make sure you guys are doing it with us here. Notice we're not spending too much time on this foam roller, we're just trying to wake things up a little bit. I want you guys on here for about 30 to 60 seconds, wake that up, get everything moving properly, and then retest to see if that actually starts to feel better. Now, foam rolling is not the only thing that we need to do. We need to start retraining the shoulder in the way it needs to move, so that way the pain stays away. Okay, so now we put the pressure in, we've influenced the tissues. Now we're gonna get into kind of stretching that anterior capsule out, stretching the front part of the shoulder out. And what he's gonna do here is you're gonna go ahead and grab these guys. Go ahead, yep, that's it. Perfect. Rotate it, and now notice his palms are against his butt here as he's pulling that band, and now he's just gonna rotate his hands even further out here, so that way it's opening that whole shoulder complex up. That feels pretty good, right? Mm-hmm. Now, the good thing about having a resistant band or something that's pretty tight like this is that it's also gonna give a resistance, it's gonna pull his hands back and open them up even further. So and once you get used to that, it's gonna feel pretty good. You wanna make it a little bit harder so that way you can start getting into that capsule. Now, one thing that I like to do is I like to stretch, but I also like to activate the muscle. So as he's here, he's only gonna sit here for about 10 seconds, and then he's gonna rotate in and he's just gonna pull that band forward against his butt, and then he's gonna open that back up again. Go ahead and open his hand up a little bit more, and then he's stretching that all out. You're gonna probably feel a little bit of a stretch on that bicep as well as he's pulling his shoulder blades down. So the band is underneath his butt here, and it's pulling his shoulder blades down and back, something that we're not used to doing, especially if we're sitting down in a desk all day long. Go ahead and relax. Go ahead, and now we're gonna make it a little bit harder, bring it in a little bit closer. A little bit closer. There you go. Now he's having, if you guys look over here, the band is very, very short. Now he's gonna pull even more and really try to influence that posterior cap or that anterior capsule, the front part of that capsule, and trying to open up that AC joint. This is an AC joint stretch to help open up the front part of his chest. As John's pulling away from here, we call this more of a Codman circle, or a reverse Codman circle, where most of the Codman circles, you're just kind of laying your hand down and letting your arm swim around its socket there. And that's gonna help influence the tissues or the ligamentous structures, the capsules in the area. In this case, we're gonna have him do it in the reverse way, where he's just kind of pulling away. And from here, you're just gonna kind of circle your arm. That feels good though, doesn't it? Mm-hmm. And it's just kind of opening up and it's pulling away as he's not putting too much pressure into his body as he's leaning forward. He's just leaning slightly as the arm is being pulled backwards. Now remember, he has some external rotation problems from the assessment. He had it to the point where he couldn't even rotate his arm out on either side for abduction or in forward flexion. And so in this case, just rotating that, and don't go a circle, and then we're gonna go slower on the other side. Big circles if you can, and just trying to let that shoulder blade pull away. Then you're gonna go back into the position here, and you're just gonna lean backwards. So pull, and now you're gonna treat this like a weight is being pulled forward, and you're just gonna go very, very nice circles around this area. You're gonna turn your palm up, all the way in, and all the way out. Perfect. External rotation here, and then back to internal rotation. Now, we're just trying to influence all the tissues that are around that shoulder, trying to pull it away, trying to wake up the tissues to start to pull that ball and socket back into place here. So the last part of this is we want to get the rotator cuff muscles to do what they need to do. So with that in mind, the rotator cuff muscles, the goal for rotator cuff is to keep the ball and socket in its place. And so what we're going to do is we're just going to get all the tissues to work together to do a specific exercise. And in his case right now, we're going to start with a bottom-up kettlebell. And in this case, he's just going to bring his elbow out in front of him here, and you're going to bring your elbow in a little bit closer to you here, and you're going to keep that arm at a 90-degree angle. And notice those tissues don't even know what they're doing, so they start to shake. You're going to have somewhat of a misfiring in this position, and sometimes some people shake, and that's a control issue. We want to get these muscles to start to work on controlling the area. So we're just going to start with him trying to maintain his posture, bring his elbow out in front of him, and this is what we call a self-limiting exercise, getting the muscles to do what they need to do just to hold a stabilization position. Now, once he's got that under control, I'm going to have him work on a pattern, which is walking forward and walking backwards here. Now, with working the pattern, your body responds and your brain responds to more pattern work than just a local response. Now, we do work on local areas, but we want to try to get this to pattern so that local region solidifies in place that we need it to. Now, bring your elbow up a little bit higher now. Let's make it harder. Let's not use your rib cage too much here. Now, you're going to walk forward and back. Bring that elbow up a little bit higher. Now, try not to use your rib cage to do that work. A little bit higher, a little bit higher. Now, bring that arm all the way up into the air. Hold it there. Walking forward and back. Now, this is an overhead carry. No pinching or pain there in that position, right? No. This is also a test for me to see, can he hold a position overhead? Bring that up a little bit higher, and that bicep should be about an inch away from that ear. Forward, all the way up. Now we're trying to work the stability. We worked on the mobility of the joint. We've recreated the motion that we need. Now we're working on stability. We're working the tissues that surround that shoulder, so that way we can solidify his movement patterns. We finished up the exercises. We're just going to try to gain some range of motion, and in this place, we've gained the range of motion that we need, but here's the biggest part. Do you feel pain?
No.
No more pain in that front part of that shoulder. So the impingement side of things are gone. Now we reassess all ranges of motion. Now, if he's not ready for the exercises or the strengthening portion of this part, we're just going to stick with the mobility aspect of it for a couple of weeks, or maybe even just a week first, before we start adding the load, the excessive tissue load.
Dr. Joe, thank you for working on my shoulder there. Definitely have some work to do with my internal rotation. For everybody else, hopefully that helped out. Don't forget to subscribe to our channel, Move Better. That's SHFT Shift Movement here in the Bay Area. Come check us out, and we'll see you guys soon.